Hi guys, and welcome back to our channel. Today we are here with Christine Vernier, certified pharmacy technician. Christine and I actually worked together at Riverview Health for quite a few years. I learned a lot from Christine as a pharmacy technician, and I am really excited for you guys to hear how she has gotten to where she is today and her history as a pharmacy technician. Hi, Christine. Thanks so much for being here.
Thanks for having me. I love this. This is great. What a great opportunity to reach out to everybody.
Yes. So why don't you try to introduce yourself a little bit, talk about your history as a pharmacy technician, kind of tell us how long you've been a pharmacy technician, and different positions and titles you have been in, kind of just give us your backstory.
Absolutely. Well, I'm a veteran, and I was given the privilege to go back to school, and I worked in the hospital setting right out of high school. So that was 1993, and I started my long career in the health field. I did not want to continue as a nurse. I liked the pharmacy tech. It's clean. I'm still helping people. I love numbers and counting and science. I mean, who doesn't love science? So when I got out of the military, I went to school, and I got my pharmacy tech license, and that was 2005. And I started working in retail, taking doctors' orders, putting them in, counting pills, making up some antibiotics for the kids, so I did a lot of window time, as well as just going through that. I did that for 2 years, and then we moved to North Carolina, where I finally got, that was my, sorry, I didn't tell you where that was. That was in California. So I just got my California license. I was not a nationally certified yet. When we moved to North Carolina, I finally got certified in 2011. And then I applied to work at the local hospital called Carteret Healthcare. Great team. I learned so much. And they had an ACE program where techs could get pay raises for each additional thing that you would learn, whether it be IVs or chemotherapy. So I was there until we left. My husband retired, and that was 2016. And then 2016, I applied to the Riverview Health, and I lucked out with another great crew, and I was all up to speed, and got right in it just because of all the knowledge I've accumulated all those years. I jumped right in and got to work there. So that's kind of like just the basic. Yeah.
That is so awesome. I actually remember when you were being interviewed, and I had just taken the position as pharmacy technician supervisor, and I was very, very new. And I was so intimidated by you coming in. I remember, our director had said she has a very long history as a pharmacy technician, and she has a lot of background, and I was so intimidated. And I think that's really important to note to new technicians, because it is okay for other people, and you are always going to encounter someone else who knows more than you. The healthcare industry is forever changing, pharmacy is forever changing. And I think that when we allow ourselves that opportunity to get to know somebody and learn from them, we grow both as people and as, in our career as pharmacy technicians. And I felt like I learned a lot from you over the years that we worked together. So I'm so thankful for that. Can you talk about some of the different positions that you had? I know that there is an administrative position that you kind of took on at one point.
Right. So, someone retired, and it had to deal with going to, I forget what they call it, but the doctors and the pharmacists, they all get together and work on the formulary. And so that we would sit around a table, and I would take notes for them. But it was interesting to hear the clinical side of things and put it into words, because things get changed and each hospital has their own formulary and how they use it. So it was a great opportunity to kind of see behind the scenes before all these rules and regulations get implemented into your hospital, which was fascinating. I mean, and so that was a great administrative piece to be in. But other than that, there's managers which deal with the other technicians and scheduling. There's a supply pharmacist. She makes sure we're all supplied, and she has to work out all the shortages and vaccines. She's got to make sure we're good to go for the season, make sure everyone gets that flu shot. And now we're looking at COVID shots too now. So so there's a lot of different pieces in the pharmacy. That's why the pharmacy technician position you can grow from, and you can be that veteran technician. I'm trying to think of all the other things that kind of go into it. So there's administrative, there's a manager, there's supply. You got your chemo technicians, you got your IV technicians, you have your med rec technicians, but those are all pharmacy techs. So
yes, very good points. If you have taken this class before, guys, what Christine was just talking about, that administrative role that she did where they do the formularies, comment below and let me know what that's called. That is the P&T. We talk about that in class. It's on your national exam. The Pharmacy and Therapeutics Committee deals with the formulary. So that's really cool that Christine, as a pharmacy technician, got to do that. It's really awesome. What would you say are your favorite things about being a pharmacy technician? If you had to pick 3, what would you say were your favorite?
I love that it's fast paced. I love that there's rules and regulations, and it's hard to pick between hospital and retail because they offer both different things. But I mean, I probably would lean towards hospital just because there's so much more going on as far as surgeries and getting people better. You know, there's TPNs and there's oncology, there's the infusion center. You know, there's so many things that us pharmacy techs put our hands in and get involved.
Absolutely. And you actually just stole my next question, which was, do you prefer retail or hospital pharmacy? So what do you think you would find what would you say would be the most challenging of being a pharmacy technician?
I believe the most challenging is pediatric dosing. You know, that PD, you have to be precise, you know.
I feel like those calculations are a little harder too. I remember that.
Those calculations are, and they're very critical. If little ones are in the hospital, it's because they're really sick, you know, yep. Because usually kids can really rebound from almost anything. So if they're in the hospital, they're really sick, and you have to really get that right. So just really pay attention to the dosing, even the pharmacists, you know, you're their second eyes, they're your second eyes. So it's like you work as a team and you just make sure that you take care of those patients.
Absolutely. What would you say has been your favorite role or position as a pharmacy technician? What's your favorite area to be in the hospital pharmacy?
It's changed over the years. You know, I really love the IV room. And then it went to oncology, and I really like oncology and infusion room. But then Katie offered me the med reconciliation down in the emergency room. And I tell you, I loved it.
I remember you loved that.
You know, you're finally with people because, you know, us pharmacy techs can get kind of shoved in behind the IV room, or, you know, that way you're with the public again. You know, it's like
you get the best of both worlds. Yeah,
you get the best word. And the best thing about being pharmacy tech, you're not going to be you don't have to be. You can be, but you don't have to be stuck in that one spot. You know, it's like, hey, I want to really try something else out. Let your supervisor know.
Yes, that's a very good piece of advice too. And I feel like there are just so many different things, like you said, that we're doing and getting our hands into. And so it's a little bit different every day. It really kind of breaks up your week too, which I think is nice. Guys, if you are listening and you are a current student, what Christine was just talking about with MedRec is the same thing that we talk about in class as medication reconciliation, or that medication history technician, or med history technician. So there gives some clarification on what we're talking about there. So keep that in mind. Let's switch gears a little bit, Christine, and talk about continuing education. When we worked together, I literally would see you sitting down in your free time, printing out continuing education, taking notes, highlighting, and really taking those super seriously. I really want to kind of hear about why you think those are so important, how that's helped you, and maybe what's the most important thing you think you've taken out of ACE.
Yeah. Well, as you know, we need, you need safety, you need law, and then you need, I think you need 2 credits in each, if it hasn't changed already.
Yep, it hasn't.
And then 18 regular as well, credits. You know what is very important? It kind of keeps you accountable for your license. You have 2 years to do it. And it keeps you fresh as far as what's going on besides what's going on in the world that you're living in. So it keeps you fresh on other perspectives. Right now I'm doing a CE on controlled substances, and it's really amazing at the statistics, and they keep up to date on what's going on in the world with people, and what us pharmacy techs can help to prevent abuse, on that topic. But as far as, it deals with geriatric, the pediatric, it deals with all. It's very important just to keep you in the loop of other things.
Yes.
So, and then, I don't know, it just makes you a really well-rounded pharmacy technician.
I agree.
Yeah, because you never know where the wind's going to send you, whether you're going to be in the administrative piece. And one other thing I would include, I don't know if it would be considered a continuing education, is getting a CPR class in, or other healthcare related things, cross reference, because then you can relate with the nurses that you're helping, the doctors. So the more you know in any part of the health field can help with your pharmacy technician.
100%. I would also say, I joined the hazmat team, and that is helpful also to be a different part of the hospital and just kind of knowing something different. So guys, that's a whole different, and the CPR, that's what I was going to say, the CPR, a lot of employers will pay for you to take that course. They want to see you grow in those areas. So that's awesome. I want to take just a second to kind of switch gears again. Christine, you've had 2 words that students might not know exactly what they are. So I'm going to ask you them, and I'm going to ask you to clarify them. So oncology, what's oncology?
It would be, oncology is the cancer treatment infusions. You have your infusion center, and then you have your oncology, and sometimes you need a little prep work with the infusion center to receive your oncology, the cancer treating medications. So,
and then geriatric,
the elderly. So they're immune compromised, so their dosing is critical as well. A lot of side effects come with medications, and especially like Coumadin, that's a blood thinner. And if one of these elderly have a fall, they can bleed, they can have nonstop bleeding, so yes. There's, or, their levels of, to keep them healthy. I don't want to get too technical.
No, I think that's great. Guys, if you are current students, I'm so glad you just said Coumadin. Guys, if you're current students, comment and let us know what Coumadin is. What do you know about Coumadin? What's the generic name, and what do we know about that we talk about in class? You should know plenty about that. I want to see those comments down in the bottom, guys. Christine, what soft skills do you think pharmacy technicians should have? What are those skills that we come in with that are kind of just embedded in us that we need as a pharmacy technician?
I would say the main one is to be aware of your surroundings. You know, it can be a time where someone needs your help. You may need to help someone, you know, because hopefully your teammates will help you out too. If you are, like I said, it's a fast pace, and you just have to make sure you're staying safe in that fast pace. So being aware of the surroundings, there may be something emergency come up, and you may have to stop what you're doing to help that emergency, and because that's what you're there for.
Yes, absolutely. I think that's really good.
Yeah.
Last question, Christine, what advice would you give to new pharmacy technicians who are just starting out in their career, just got their license and their certification, and they're ready to hit the ground running?
Okay. Well, I stick with the I care motto. I stands for integrity. C stands for commitment. A, advocacy, which means for your patients. And R is respect, and E is excellence, because I know you can do it. You just have to stick with the I care mentality.
I absolutely love that, Christine. That could not have been a better answer. You guys, I hope that we answered some of the questions you might have had about hospital versus retail pharmacy technician. I hope you took something from this video and enjoyed it. If so, please give it a thumbs up. And if you have not already, please subscribe to our channel. It really helps us to be able to continue to create content for you guys. Christine, thank you so much for being here with us today. We really appreciate it.
Thank you. I appreciate being here.
Thank you so much.